You know, it's one of those things that can really make your heart skip a beat, finding a lump in your neck. Your mind just starts racing, right? But what actually happens when doctors find one? Well, today, we're going to play detective. Let's dive into this medical mystery and follow the clues together.
So, picture this. You feel that swelling. It's a surprisingly common situation, but it can feel pretty isolating. The big question is, what's the game plan? What's the process from that moment of discovery to finally getting a clear answer? Let's trace the steps.
Okay, so let's set the scene. Our case file today starts with a 36-year-old woman. She noticed a small swelling in her neck, and over 3 years, it grew, but ever so slowly. No pain, no other symptoms. It was just there. This is our very first clue.
And get this, thyroid issues are a whopping 4 times more common in women than in men. And that's not just some random statistic. There are solid biological reasons for this. So what's the deal with that difference?
Well, it really comes down to 4 key things. First off, thyroid cells actually have estrogen receptors on them, which means that hormone can literally encourage them to grow. Then you've got pregnancy hormones like estrogen and HCG, which can put the thyroid into overdrive. Women also need more iodine, especially during pregnancy. And to top it all off, they're generally more prone to autoimmune diseases like Hashimoto's, which loves to target the thyroid.
All right, let's get into the doctor's detective work. And you might think the first step is some high-tech scan, but nope, it actually starts with a conversation. The story of the swelling itself provides the most critical first clues.
So what the doctor is doing here is basically listening for clues in your story. On one side, you have clues that point towards something benign, not cancerous. We're talking slow and steady growth, no pain, nothing else going on. But then you've got the red flags, things like super fast growth over just a few weeks, a sudden change in your voice, or trouble breathing. In our patient's case, that 3-year history, that points pretty strongly toward the benign column.
Okay, so once the doctor has the backstory, the detective work gets hands-on. We move to the physical exam. And it's amazing how much simple observations can tell you about where that lump is really coming from.
And this is where we get to a really cool old-school diagnostic trick. It's a super simple question, but the answer tells us a ton. Does the lump move up and down when you swallow? This little trick is called the deglutition test. Kind of fancy, right? So here's how it works. Your thyroid gland is physically attached to your larynx, your voice box. And when you swallow, your whole voice box moves up. So anything attached to it has to go along for the ride. And in our patient's case, yep, the lump moved. Boom, just like that, we've zeroed in on the thyroid.
So now we know our suspect is the thyroid. It's time to bring in the modern forensic tools, so to speak. We need to get a look inside to really see what we're dealing with up close.
First up is a neck ultrasound. It's totally non-invasive, and it gives the doctors a really clear picture of the nodule. Are we looking at something solid, or is it filled with fluid? Does it have clean, smooth edges, or are they kind of jagged? All these little details help them figure out the level of risk. And all those characteristics feed into a scoring system called TI-RADS. Think of it like a rating system from 1 to 5. A TI-RADS 1 is basically a nothing to see here, folks, while a TI-RADS 5 is a we definitely need to look at this more closely. It just creates a really clear, consistent way for doctors to talk about risk. So if that TI-RADS score comes back on the suspicious side, then we move to the gold standard test, a fine needle aspiration, or FNA for short. This is just a biopsy, where a super thin needle is used to grab a small sample of cells right from the nodule so they can be looked at under a microscope. And guess what? Just like the ultrasound has a system, the biopsy results do too. This one's called the Bethesda system. And what's great is that it's not just a yes or no answer. It gives a really specific percentage risk of cancer. So a category 2, benign, has basically 0 risk, while a category 6, malignant, is pretty much a sure thing. This gives everyone a super clear roadmap for what to do next. Okay, so let's recap. We've gathered all the clues, the patient's story, the physical exam, the ultrasound. Now we can finally put all the pieces of the puzzle together, solve the case, and figure out what happens next.
So what's the verdict? Well, in technical terms, it's a solitary thyroid nodule, probably benign, in a clinically euthyroid state. But what does that actually mean? It's simple. We've got one single lump, it almost certainly isn't cancer, and the thyroid itself is working just fine.
So you hear benign and you think, great, case closed, right? Well, not always. Surgery might still be on the table for a bunch of reasons. Maybe it's big enough that it's causing pressure and making it hard to swallow. Or maybe it's just a cosmetic thing. Sometimes these nodules can even produce too much hormone. And sometimes people just want it gone for peace of mind. At the end of the day, it's a conversation between you and your doctor.
So there you have it. We've followed the trail of clues all the way from that first scary moment of finding a lump to getting a clear, manageable diagnosis. The whole point of walking through this is that knowing the process takes away a lot of the fear, It empowers you. So now that you've seen the whole investigation unfold, what's the one key question you would want to ask your doctor if you were in that situation? Knowing the steps is the first